Good morning, everybody. It is Friday the 20th of September. Welcome to my latest update from the hospital. Everything I'm going to focus on this week really is as a consequence of the government announcements that were made early this week, reintroducing some restrictions to the nation. And of course, this is because the number of infections per day has risen from a low point of 350 approximately. It's now up to 6,500 infections per day nationally. So we know that as far as the nation is concerned, the second wave of COVID is very much with us. Now, I'm very pleased to say that the hospital remains infection-free, and we will do our utmost to ensure that that continues to be the case. Now, we all know that our staff were absolutely brilliant in handling phase one, and I'm sure they will be equally brilliant in handling phase two. We're actually in a much better state of readiness to handle phase two because, of course, phase one it was really new to everybody. It was a once in 100 years pandemic, but now, of course, we've learned many things from how we handled phase one. We're in a much better state of preparation with things like personal protective equipment. So I've got every confidence that our staff will handle phase two brilliantly. Having said that, as I said, it's vitally important that we do all we can to keep infection out of the hospital. We know the way in which infection is transmitted is by person-to-person contact. So we need to do all we can to minimise person-to-person contact and also to minimise the number of movements around the hospital. Now, in a similar way to the way in which the government is working, we're very keen to maintain business as usual as much as we can. So we are not going to go into a full lockdown in the way that we did for the first phase, but we're definitely going to be taking and are starting to take some measures which do minimise the possibility of transmission. So, for example, we do not intend to return to the zoning that we had for phase one, but we will be looking at ways in which we can reduce movement around the hospital and minimise person-to-person contact, and expect to see a further announcement about that next week. As far as visitors to the hospital are concerned, we are currently in actually the first week of 2 weeks of visiting, and at the moment that will continue. But I think the expectation has to be that when we go into the next phase of visiting, it is likely to be more restrictive rather than less restrictive because of where we are in terms of trying to prevent the second wave from coming into the hospital. And then in terms of staff who can work from home, we are not issuing a blanket work from home instruction in quite the same way we did in phase one. But I am expecting staff who can at least do some of their work from home to have discussions with their line managers about what their specific working patterns should be. And then a critically important message for everybody, whether you're a member of staff watching this or a relative, it's really absolutely adhering to all the basic measures to prevent the transmission of infection. Washing of hands, maintaining a 2-metre distance. I'm afraid for family visits that absolutely means no touching of loved ones. You have to maintain a 2-metre distance, wearing of masks, and so on and so forth. These measures, they're simple measures, but they're all vital in preventing the transmission of infection. And that's our aim. That's what we have to do. We have to do all we can to keep the second wave of the COVID virus out of the hospital. I'm sure I can count on everybody's support to do all we can to achieve that. Thanks very much.